Quite a lot to get through today. Let me just click on that, which is great. I'm just going to cover the program. So most of you will know me, some of you might not. I'm Angela Gill. I'm working with Community First and Gosport Voluntary Action on facilitating today's health forum. The speakers for today, again, some of you will know them. Jackie Hartless, the Health and Wellbeing Manager from Community First. Her camera's not working, so you won't see Jackie, I don't think, but you will hear her, which is good. Then we've got David Barker, who's Head of Communications and Engagement for the Hampshire and Isle of Wight Partnership of CCGs. Then we've got Melanie Whitfield Tinkler, who is the Charity Director for Harbour Cancer Support. And as you know, the theme is all around sort of COVID, it's transition and recovery out of COVID. So all our guest speakers will have some sort of reference to that aspect. Then we've got Terry. Lynn, has Terry arrived yet? Just checking.
Helpful if I came off mute. Terry
Parkin.
No, not yet.
Okay, there's no pressure. The good thing is we've got a couple of speakers before. We've managed it. So Terry is due in shortly. She is the bereavement coordinator for bereavement care, and she's going to talk a bit about the services and what's available and demand really around the COVID period. So that's Terry. And then I'm just going to highlight the event that's coming up, and many of you are already booked in, and it's called Your Health and Welfare, and it's on Tuesday the 20th of July, 10:30 to 1:30, but I'll pick that up a little bit later. It's going to be at CMAS campus, which is Meteor Way, near Leon Solent. And then I'm going to really mention the last dates of 2021 of this health forum and just explain what we're thinking of for 2022. So that's the plan. So I'm now going to hand over to Jackie Hartless, please.
Okay, well, I'm really sorry that my camera's off, but it says it's on, so you have to believe it. So it's just a little update really on what some of the two CVSs are doing at the moment. There is, and I know Angela's going to talk a little bit more about this later, so I'll just briefly mention the single point of access pilot, so the SPOA as it's generally called, and it covers Gosport War Memorial, and it's about the CVSs giving information about what local support is for people on discharge from hospital. But as I say, I'll let Angela tell you a little bit more about that one. Gosport are offering local groups who want to meet a safe haven, one free morning a week, I believe, or one free morning. Sorry, one free meeting.
Yeah, they can have a session. Yeah, it could be morning. It all depends on availability.
So if you contact GVA, you can book that. Also, Gosport in July, they're taking delivery of and will hopefully have available free hand sanitizer. So this is available to local groups as they start to reopen and they're starting to meet up with people face to face. And again, I think they will be sharing details with members once it's actually arrived. So the contact would be through them. Something that both Gosport and Community First offer, the Walking for Health. Groups of 6 are now up and running. And there are details on both websites. We will actually be running taster sessions at the event that Angela was mentioning on the 20th of July. So that will be very short, sort of 15 minutes walks, just to see if people like it, or maybe if they're interested in becoming a walk leader. There's also, and I don't have the link, but I'm sure we'll have it in time to go out with the minutes. there was a link for NAVCA offering free PPE. So we'll make sure that goes out in the minutes. Generally, and I think this applies to both Gosport and Fareham, we're looking to support groups to help them recover from having not been able to operate for the last 18 months or so. So we're able to help them restart their services, to look to see what support they actually need, whether it's about developing new services or whether it's just about, you know, restarting and how they can do that safely, following any restrictions that are still in operation. There's also a really big push for the voluntary sector generally to help to rebuild some of the community resilience and, you know, adopting sort of like a strength-based approach to help people help themselves and reduce some of the demand on statutory services. So we will be holding a virtual volunteering fair on the 14th of July. It's 9:30 till 3 p.m. It's free to everybody. And I think there are about 40 organisations that will be virtually present. And it's about talking through opportunities, and a lot of these will be flexible ones. So that's an event that we're putting on. And as I say, it's still virtually. So I'm just, what else have we got? There's still something called a Get Going Again grant. And that's Hampshire County Council. It's a way of groups offering sort of health and wellbeing support, and they can access some funds to enable them to expand or develop new services. So that's the Get Going Again grant. The Local Resilience Forum is now very much focused on test, trace and isolate. And there is a test, trace and isolate board under the Local Resilience Forum in Hampshire. It's designed to provide support for vulnerable or clinically extremely vulnerable people who may need to self-isolate and who are likely to need some additional welfare support. So there's also some transport grants are still available for funding to I think it's certainly going to be available through the autumn and until December, or if it's been spent. So it's about supporting people to get booster vaccines, flu jabs, that sort of thing. So it's for access to medical appointments. And I think that's probably where I'm going to finish up. So I'm now going to hand back to Angela.
That's brilliant. Just before I ask if anyone's got any questions for you about either Gosport Voluntary Action Services or Community First Services, just to pick up on what you mentioned, what we're calling the SPOA pilot, the single point of access. What it is it's a pilot project for 8 weeks, and I'm representing Community First and Gosport Voluntary Action. And it's a way of looking at whether the community and voluntary sector can add value at a point of hospital discharge. So we're looking at whether that would be an individual training. So for example, at the moment, I'm looking at pulling together some training about what is out there available in the Fareham, Gosport and South East Hants area. So it involves Gosport War Memorial Hospital, it involves QA and the feeder hospital, which is also Petersfield. So watch this space, it's really good. It's around health working more closely with the community and voluntary sector to the benefit of patients that are either about to be discharged or have just been discharged, and possibly they might be lonely, they might be bereaved, they might have a cold house, they might have a broken boiler, they might have all sorts of social issues. And the idea is, can the community and voluntary sector train up the clinicians and those who are on the discharge teams to understand how very quickly and easily they could refer some of those patients for more help. So watch this space. So are there any questions, anything else that anyone would like to ask of Jackie in the briefing that she's just, it's quite comprehensive, lots of points that she's covered. Any questions? If so, if you could open up your chat box. I'm just having a look at chat and just making sure, just seeing if there's anything there. Oh, welcome to Ros. Ros is just, Ros is one of the clinical directors. She's dipping in and out, but it's really good. Really, really nice to see you, Ros. So thank you very much indeed. Okay, I can't see any questions for Jackie, so that's fine. I'm now going to move on, and I'm going to hand over to David Barker, who's Head of Communications and Engagement.
Thank you, Angela. Hello, everybody. As Angela's just said, I'm Head of Communications and Engagement, which is kind of a slightly outdated title. It's more related to the job that I was doing as part of our old organisations in CCGs, and now we're part of the Hampshire, Southampton and Isle of Wight 1 CCG. My role really covers communications and engagements, looking over an area of Portsmouth, South East Hampshire and Fareham and Gosport, which is why I'm here today. Ordinarily, Elizabeth Kerwood, my colleague, would be talking to you, who many of you will know really well. She's probably on the call, actually, but we're going to sort of vary who does what in some of these meetings in future, so I'm picking up on some of that today. So the Hampshire, Southampton and Isle of Wight CCG, as you will probably be aware, hopefully be aware, has been in existence since the 1st of April this year and brings together all the CCGs across Hampshire. That's still with the exception of Portsmouth CCG. They're remaining separate for now because they've got their Health and Care Portsmouth programme working very closely with the Portsmouth City Council in a defined area, working really well. But of course, we link and work very closely with our CCG colleagues there in all that we're doing. So we know it takes a little time for changes to bed down and for new structures to take effect, but it's important to reassure everybody that the focus is still very much for us on what we in the NHS, as you might expect, would have some jargon for it. So we're calling it PLACE, but this is all about the local work that goes on in Fareham, in Gosport, in parts of South East Hampshire, that keeps all of the brilliant links and connections we had in place already and strengthens them in terms of what we're doing. Working as a bigger organisation really helps us develop that and get scale and broader approaches to certain services where it makes sense to do so. But we are still very much focused on working locally in partnership with all sorts of different organisations and all of those that you represent. Many of you will know Lucy Doherty, who stood down at the end of March and has been replaced by our new non-executive lay advisor, Inga Bird, who some of you will have met. And Inga will be really keen to get out and about and talk to different people in some of the groups that we're all part of as things move forward. And this transition really takes us to the next stage of the NHS reorganisation going on at the moment and moving into integrated care systems that take effect from April of next year. So that's another sort of push towards ensuring that we have really strong joint working right across Hampshire and the Isle of Wight and everything that we do. And recently the government produced what they're calling a design framework. So it sets out guidance in terms of how we move from where we are now onto the next phase of development. And there's some really important stuff in there, which might be worthy of a future update at one of these meetings. But what we can also do is share some information after this meeting with you to help give you an understanding of how things might evolve over the next few months in terms of what we're doing there. So that's kind of the bit about the structure of the organisation. Clearly, the real focus for us at the moment is on the vaccination programme. And it's probably worth mentioning that we reached a huge milestone last week for the local NHS across Hampshire and the Isle of Wight, where we hit 2 million vaccinations delivered in total across that area, which is absolutely fantastic. And across Fareham and Gosport, that our sort of share of that is around very close to 250,000 vaccinations having been undertaken since we started, you might remember, back in December. And that's about 91% of adults, we think, over the age of 30 have received their first COVID jab. And now the push is really on to make sure that as many people as possible receive at least their first vaccination by the 19th of July. And then clearly now we have a 8-week gap for people to get their second dose. And so a real focus again on ensuring that those are in place as well. It's been a brilliant effort by all sorts of people involved in that, not least the volunteers who have supported us through that programme, and of course the clinicians and the people who have run the administration side of things. And we're just going to keep it going and really push on now. But what's important for us as part of this is around vaccine, what we call vaccine hesitancy. So we know there are all sorts of people in the community who haven't yet come forward for a variety of reasons to get a vaccination. And we're really keen to understand why that is. And we're keen to work with all of you really in terms of making a request of you that if you think there's information that we're not getting out to people in the right way, or if you think there are people who could benefit from conversations with us about the vaccination, or if there's anything you might be able to do to support us in sort of working with people who aren't sure about whether or not to have the vaccine and how we can persuade them to go ahead with it, then we'd be really interested to hear from you. Certainly if you want to email me, if you've got thoughts or suggestions about that, that would be fantastic, because we're trying all sorts of different approaches in our local communities now to see what we can do, but we're very conscious that there's lots still to do in that arena. And it's kind of a similar picture, moving off vaccinations and onto just what we're finding about the access to services in general in the NHS at the moment. So you may have heard that it is really busy in our local NHS at the moment. So whether that's in primary care and getting appointments with GPs, whether it's urgent care and the front door of ED, we still are trying to get the message out to people about how they can best access services and access them in the right way. So again, we remain really keen to ensure that we're providing information to people in the most appropriate ways. And we're developing plans at the moment for some summer campaign activity to boost that. But I think, again, one of the things that would be really important for us and really helpful is if, again, you've got thoughts or concerns or worries about the way that information is being pushed out, whether or not we're doing enough to help people understand what those choices that they now have are and where they can go for help when they need NHS help in a hurry. If there are different ways we can provide the information, if there are people we can talk to understand a bit about why people make the choices they do to use particular services, then again, it's something that would be really great for us to hear from people about and to understand what's going on. So again, really keen to make sure that what we're doing is targeting information appropriately in the right way and helping people understand what options they've got. And a lot of those still revolve around NHS 111 first. So that's a key part of what we're advising people to do, is to think 111 first before they actually decide to go to the emergency department if their need is urgent but not an actual emergency. And there are ways you can do that through contacting 111.nhs.uk as their online service. And there's a similar picture as well with the sort of GP practices, in that we're really keen to, convey the message that practices are open and are seeing people face to face. But it's really important that we try and manage the demand, because there's still social distancing, there are still infection prevention issues within our surgeries. And so the stuff that we're looking to do is around helping people understand the approaches we're taking to manage access to some of those services in the most appropriate way. And practices do have online opportunities for people to get to contact them, and the NHS app is a really good tool to download as well. So they're the messages we're certainly trying to push out, but we absolutely recognise that not everybody has access to the digital solutions that are out there. But the more people who do that we can encourage to use those services, it will really help us. I think, Angela, I'm not sure if you've got your bell and whether you're about to ring it.
I'm looking at it. So the reason I was going to just hand over is I can see in the comments in the chat box that Ros is happy to give a couple of minutes of update, and we're in hand for time. So if you don't mind, David, what I was going to do is ask
Absolutely.
Ros to unmic, and just perhaps I can see some of the interesting facts that she's popped into chat. Just before I do, if anyone has joined later and is new, please open up your chat box. There's all sorts of information being shared, and do introduce yourself in the chat box. So Ros, would you like to do a little update?
Yes, no, hello everybody. I just wanted to say a few things. So yes, really delighted that we have got patients who do want to have their vaccine, which is fantastic. I think a lot of the issue is that we've got a lot of 18-year-olds or over 18-year-olds currently who are away at university, so sort of haven't quite re-registered. So the hope is that we can actually get everybody done. I think it was Ted had asked about an update on boosters. So Ted, I'd love to say that we knew exactly what we were doing, but the problem is we don't, because we've had no information yet. What we do know is that it's likely to be one booster, and there'll probably be 5 or 6 different types of vaccine. It might be Pfizer, it might be AstraZeneca, it might be one called Moderna, or it might be 2 or 3 others that are newer ones that the public haven't heard about. The plan initially was that we could perhaps give it with flu jabs at the same time. Part of the issue of that is that lots of us won't get our flu jabs sooner, and so we all feel in primary care that perhaps we'll get on and do our flu jabs, because we don't really want to wait. It's probably going to be October, perhaps the beginning of November, before we actually get the boosters that we can start using, mainly because they're doing really thorough trials to make sure that we know that what we're using is the right one that gives the best response. So they're trying it with half dose, full dose, different ones at different timings, so that we can be sure that we're getting the right one. And obviously they've been able to throw a lot of money into this and do a lot of research much quicker than we've, normally this would take years to do, but we need to get the right research. So that's why it's not that no one's decided yet, it's that they're basically doing lots of research to find out which is the right one. We will definitely, I think, want volunteers, and our volunteers have been amazing. I don't know if anyone's had to come to Brook Lane, but we have a huge mechanism and machine, as all the other PCNs do, to ensure that everything runs as smoothly as possible and that we can get as many vaccines into arms as quickly as we can. Okay, sorry.
Has someone got their mic on? If someone's got their mic on, Lynn, can you have a look and can you just turn it off, please?
Sorry, I thought that was a question. That's why I stopped.
No,
so the other question, the other comment that I had was really about the fact that primary care is open. Primary care is definitely open, and we have been open the whole time. I suppose one of the things about 111 First is 111 First is great if you're thinking about going to A&E, but I think if it's between 8 and 6:30, Monday to Friday, please ring your GP if you feel it's something that you need to speak to us about. But there are an amazing array of other people that can really help. And I suppose one of the messages that all the primary care will be bringing out soon is getting our patients to the right person the first time. So for example, we've had lots of hay fever and adults with conjunctivitis or allergic conjunctivitis this week. And actually all of those things, the chemist can do a brilliant job of diagnosing that and treating it, and can give you something over the counter. And for stuff that's less urgent, I would say, in terms of perhaps you might need a sick note and it's an administrative task, then all the e-consults that way can be really useful. But we are always open and have always been open. And I would say that all practices are going back to face-to-face. And certainly in our practices, we've never stopped seeing patients face-to-face if they clinically needed it. So it's just to reassure everybody about that, really, because that's something that all the CDs have been really concerned that we portray that message, because the media is really, I don't mean our media, I mean the paper rag media, and the BBC is all very good at telling everybody that it's not open and we're shut and how outrageous it is. And actually we'd basically like to say, please try us, and then because we basically want to make sure that you get to the right person at the right time. That's what I wanted to say, really, unless anyone's got any questions.
That's brilliant. Yeah, any questions for either? So we've had, thank you very much, Ros and David. So I've seen a couple of questions which Ros has picked up. Are there any other questions before I move on for either Ros or for David? I'm just having a quick look at chat. Just pause for a minute just to make sure. if you keep an eye on chat, Ros, just in case there's one or two that can't.
I do have one question, Angela, for Ross, if I may.
Okay.
We're all of us used to using the pharmacist, but something like 83 to 87% of people in the UK do not pay prescription charges. When they go to a pharmacist, it often means they incur a charge, which is a huge disincentive for that part of the demographic to use the pharmacist. You're muted, Ros.
You mute, Ros.
Sorry, I've got too many screens open with too many arrows. I agree, but what I think that we're going to have difficult conversations about is the fact that, for example, to do a prescription for aspirin, which costs 70p, costs the NHS about £20. And so I think we need to start having more of those conversations, because there's, I will often say to patients, yes, this costs 90p, this costs £2.50. Those sorts of things that I would encourage my patients to get, because if they don't get the flash one, that's not the, so if you don't get Voltarol, but get the equivalent gel, or get your ibuprofen gel, that's £2 something compared to £9 for a branded product.
Oh, absolutely get that. But yeah, the pharmacist is often the person that validates whether they're eligible for a free prescription or not. Why can't the system allow the pharmacist to validate whether someone would qualify for a free prescription and then provide them the generic diclofenac if that's what the wish is? Why does the patient have to be charged at that point, when actually it would be cheaper if they got all the many of the prescriptions directly from the pharmacist rather than going via the GP, which incurs an additional cost as well as taking your time up?
Hang on, sorry, so are you saying for over-the-counter stuff, or for you saying, for example, if they need some paracetamol?
Anything that you would prescribe for a patient who would then get it free through the system, and we all know the add-on costs of going through the prescription system, why don't we allow the pharmacists, which we're encouraging to be a source of direct contact now for healthcare advice and prescription, why can't they make a free prescription judgment against the same criteria for whatever it is they feel would have been prescribed? I mean, you do sometimes prescribe over-the-counter drugs for people as well.
Well, we're actually trying less and less to do that, because that's the whole point, because basically the NHS is broke. So we are trying harder and harder. I think it's very hard. So if a patient is taking 8 paracetamol a day, you'd have to go every 3 or 4 days to the chemist, which is, undoable. So yes, we're giving those sorts of things, but I still get patients who get free prescriptions. I still encourage them to try and buy them, because we're trying to empower our patients to self-manage and to have a tick box. And part of the issue that we have is that some things that get given, like cough medicine, don't really work that well.
Oh, no, I get that, absolutely. No. But you can't have your cake and eat it. You can't complain about the cost of prescriptions when they go through a GP surgery, and then to people go to the pharmacist, then criticise the pharmacist of prescribing homeopathic type medicines like cough medicine. What I'm saying is there's mixed messages going to the patients, and it's not the patients around this Zoom camera that's the issue. We'll all drop into the pharmacist and avoid the system. It's that mass of patients who are constantly attending for reasons that don't actually require a doctor or practice nurse to see them.
But the reason they'll attend. But the reason they attend is because they want a free prescription, and they don't like the fact that we're actually telling them to pay for it.
You've got it.
So we have to, and we're telling them no. So I think part of the issue is.
Don't tell them to go to the chemist. Tell them no, you don't need anything.
No.
Okay, on that point, I'm going to have to move us on. But do carry on in chat, you two. That's absolutely fine. So I'm now going to just move us on. That was really interesting, really engaging. Thank you both. So I'm going to introduce Melanie Whitfield-Tinkler, who is the Charity Director and Lead Counsellor for Harbour Cancer Support. So over to you, please, Melanie.
Okay, hello everybody. I did do a talk to this group a very long time ago, but I think that a lot of the members of the group have changed. So I'm just going to start off with a little bit of history for those of you that don't know anything about Harbour Cancer Support. So we were initially called Gosport Cancer Support, based in Gosport bus station, and we were actually a project within GBA funded by the Big Lottery Fund. When that funding finished, a decision had to be made where we went for then, and it was decided that the best route was to become an independent charity offering our support to a larger area. We'd always sort of say Gosport and Fareham, but we made it more pronounced to sort of say South East Hampshire. So we do cover Portsmouth, Cosham, Waterlooville, sort of a far bigger area. We stayed in our premises in the bus station until 2018. As much as for all the years they weren't ideal because they didn't have disabled access and so on and so forth, but we made the best. And so we actually moved to new premises in Stoke Road in 2018, which was a big step for us because at that point we undertook responsibilities like rent, etc., which we'd never had to pay before because the council had provided the premises. So you know, I think I just sort of point out it should be our 20th birthday this year, but let's just say we've decided we're going to celebrate our 21st, not our 20th, because of the state of things at the moment. So a little overview of what we do. Our key phrasing is we provide practical and emotional support to anyone affected by any cancer. And what I mean by that, you know, a diagnosis of cancer isn't just about the patient, it's about everybody involved. So obviously immediately the family, but it's also friends. You know, there's lots of people out there that don't have immediate family in the area, but they have a really close friend, and so that person's affected. So we say friends, carers, work colleagues, anybody that it does affect, because any one of you that has been unfortunately affected by a disease like cancer knows that it does have a knock on to those around you. I've listed our services there that we offer: counselling, befriending, specialist support for children, complementary therapies. At the moment, I think it would be massage, Reiki, Indian head massage, reflexology, hypnotherapy. They vary depending on what volunteers we've got. We're not in a position that we can fund any of those, so it does come down to who's being generous enough to volunteer their time to us. We'd started up mindfulness not long before COVID came along. We have a very successful art group that produces a calendar every year that we then sell for fundraising. And we now have a successful craft group, again, which it's a great supported group for the members, but they also produce items that we can then sell to raise funds to help keep us going. We do coffee mornings, and basically in normal times we're a drop-in centre, open 6 days a week. So anyone can just call in if they've got a question, if they want a cup of tea or coffee, just to have a chat. So how did COVID-19 affect us? Well, just, you know, on a side issue, I was actually off sick at the time, which wasn't ideal. I'd had knee surgery myself, but actually it was a godsend because I'd set up a remote office at home while I was off sick because I couldn't drive because of knee surgery, but was quite able to do things. So actually I had a phone line at home. I had everything done so I could work from home, which prior to last January wouldn't have been the case. But when it was obvious the restrictions would come in, and we basically spent the 2 weeks prior to actually closing our doors, keep changing the plans, we cancelled groups first of all, then we cut back on our more vulnerable clients. Then obviously first lockdown was coming, so we had to completely shut the doors and move everything online. Obviously, number one was our actual main clients, as I call them, that were having counselling and befriending at the time, because obviously they were the most in need. But we were also really aware of our clients that just call in, maybe haven't got as high a need at that point, but in our mind, they were going to be the ones that were going to struggle the most probably through COVID, because we know they call into us to come and have some company, get out of home and not feel so isolated. So we straight away literally worked through our client database and set up a system of phoning round, just checking in on them, checking in, making notes of who had what support, and then absolutely on a one-to-one basis decided how often we call people and so on and so forth. The phone lines were operational, but it went to an answer phone, which was always a little bit of a concern, whether people would leave message, but people seem to. You know, it was a decision I had to make from me working from home, because my husband also had to move his business to home. So we actually had 6 phone lines coming into our house at one point, and there was just no way we could have all phones ringing. And obviously being realistic, because of the types of our clients, I need to make sure that I can deal with them in peace and quiet, not necessarily at the moment they phoned. But clients were really good. You know, sometimes I phoned a client back within a minute. Okay, sometimes it was a couple of hours, but actually they didn't mind. And we have had a number of new clients come along, and that's what my fear had been, that not being there, that people just wouldn't think we were there. We had a lot of referrals from health services in the early days, particularly from sort of district nurses, people like that, that maybe they were pulled it back on their services that they would normally have done. And so they were getting us to phone people and tuck in. So I'm happy that, you know, we did what we could. Obviously, the big other panic was finances. We don't have core funding from anywhere. We have had a few grants the last couple of years that we've applied for, but they've been very specific grants. And so I was like, our fundraising is stopping. We're not having anyone come in. We're not going to have any donations. What's going to happen? And I will admit that's probably where my biggest stress. I was quite comfortable what we were doing with clients, but we were really lucky. We applied for some emergency COVID funding that we felt we were suitable for and got some funding very quickly. And so, you know, we did okay. And then as time went on and there were some government grants and everything else. So I can say we're okay. I'm never going to say everything's fine because we don't know when it comes back, but that pressure has been taken away from us. So we've been able to focus on clients. So current situation, I've said we are not open. And this comes down to, I've had discussions with other places recently because I suddenly had a panic a few weeks ago because I was hearing places were opening. And I thought, but we're not open. You know, the rule of 6 inside is a big issue for us because when we've moved to these premises, we've gone for smaller rooms that are more friendly for the clients and everything else, but they're not well ventilated and so on and so forth. So, you know, we cannot do a lot of our stuff because of the rule of 6. We have put screens up on the entrance. We have put screens up in one of our larger rooms. So we are doing some face-to-face counselling where clients would prefer to be seen or where clients need to be seen. You know, we have some clients with hearing issues and they just haven't, you know, over the phone is a problem for them. But actually, most clients have been quite happy. So, you know, we had hoped to reopen this week, but we're not there yet. But that's my term of open. What I've decided is, in a lot of people's definition of open, they would say we've been open all along because we have been supporting people and we have been there for people. So, but I'm looking forward to the day we can say our doors are open and people can come in. As far as planning for the future after COVID, I don't know what we're going to be dealing with. It is an unknown entity. None of us could have anticipated COVID-19. None of us saw what was going to happen. So none of us can know what's going to happen afterwards. My honest gut is we are going to be really busy eventually, but I think it's going to come back very slowly. I think people who are more vulnerable have tended to go into themselves a lot. And so we actually are going to start a slow gradual return, if that makes sense. We've got issues over, everyone says keep your windows open for airflow. We have an issue with that because of confidentiality. It doesn't work. Using masks in counselling again doesn't work. You know, so much of counselling is the non-verbal side. Having said that, we've obviously been doing it over the phone. One of the questions that's come up amongst our volunteers is, can we request people to have the vaccine? Because our clients want to know that we've all had our vaccines, but can we actually say to people we want them to have the vaccines? I don't know the answer to that one at the moment. Those of us that are going back, first of all, we've had our vaccine, so that's taken the problem away, but it's something that's going to come up. And we also don't know how many of our volunteers can come back. You know, 18 months is a long time. Priorities change, people's habits have been broken, and that's the word I use for everyone. I think we can all be honest and say we've changed what we do, most of us, and it's given everyone a chance. So, and then on the financial, when will events return? When will people want to go to events? And is there going to be a recession in the UK? You know, there's talk about it. And the truth is, we know if money is tight for people with the best will in the world, they haven't got it to donate to charity. So we're just going to have to wait and see. That's the truth. All we can do is keep looking. And my view is, what's the key? We've got to stay positive. What I says to any of our volunteers, clients that are concerned, we're still there. You know, unfortunately, the Haven and Titchfield closed, and I've actually heard this week that the whole of the Haven is closing down nationally. So when you see a big charity like that that's been around for a long, long time is now shutting, you know, we're small enough. I see we've got through this and we're going to come out stronger, and we're just going to keep listening to our clients as to what they want going forward, and actually using it as a positive that we've been able to review what we do, question some of it, and look at how we go forward. So some of our clients have preferred telephone and video support, so we are now going to offer that going forward to people if they want it. we are financially stable at the moment. I can't say whether in 2 years' time we'll still be in that, but that's been the reality of how we've been always as a small local charity. So just keep believing in what we're doing, and I think that's what I would say to other people.
Great. Well, thank you very much indeed.
Obviously,
I've got one question, Melanie, already in there from Ted, and he's asking, do you anticipate numbers will return to pre-COVID once you are face-to-face again? What do you think? You sort of mentioned that, didn't you?
I think long-term our numbers will be greater. At the moment, to start with, we are planning to reopen from July. I don't think it will start to come back till the autumn, if I'm honest. I haven't got a strong reason why I say that. It's just a gut thing. But I think that it's going to take a long time. What I will say is I recently looked at our figures, and we actually did more counselling in the last year than we did in the previous year, and we've been growing year on year. So that's where I feel confident we're still providing the service. But my honest gut is long term, because people who've been bereaved particularly have got a lot to deal with, and as life goes back to normal, it's going to affect them more and more. People who have been diagnosed during this time, there's a lot of question marks. Were they diagnosed quick enough? Were things different? And they need to work through those questions. Personally, cancer services have been there. If you've gone for it and looked for it, it has been there. So I wouldn't in any way be saying those people hadn't, but patients have got those question marks. And that's what we're going to be dealing with for a number of years, I think.
That's great. Well, I'm going to ask Melanie, I'm going to ask you to just keep an eye on chat because I need to move on. But if there's any other comments or questions, there's a few nice comments in there. Any other questions, please pop them into chat. Melanie's going to keep an eye on that. So what I'm now going to do, thank you very much, Melanie. I'm now going to hand over to Terry Parkin, who's the bereavement coordinator for bereavement care. So over to you, Terry.
Hello, everyone. It's lovely to kind of meet you all. I just want to apologise, my camera's not working at the moment, so I do apologise for that. But yeah, no, it's lovely to be here. I just thought I'd go through a few things, sort of how COVID has kind of impacted the work that we do. Because as I'm sure we'd all agree, any kind of traumatic event, whether it's the pandemic or, in our personal lives, can take both an emotional toll and cause traumatic stress on our clients and on ourselves, especially when we're, bombarded with round-the-clock news and social media coverage. We're constantly seeing images and seeing those figures of losses and the death toll. And that can be overwhelming, really. Sorry, Gam, could you go back another slide, Angela? Sorry.
Yeah, sorry.
Thank you. And grief, as I'm sure many of you would be aware, grief can be extremely difficult to cope with at any time. But it could, we found that for many people, it's been especially difficult to manage during the coronavirus pandemic. And it's not just one feeling, but it's often many feelings that follow on from one another. It could be that people's mood changes quickly. They might feel shocked or numb, sad, anxious, tired, relieved even sometimes. There's lots of different emotions and thoughts and feelings that are involved in grief. And there's no timetable for grief. Everyone is different and we've all reacted in different ways. And we've found that, we've been fortunate that we've been able to continue working with our clients, albeit in a different way than what we previously did, which I will talk about a little bit later on. So yeah, we found that a lot of our clients have particularly struggled this last year, and we have seen the number of people contacting us for bereavement support has risen a lot, really. And there's lots of reasons for that as well, why people have found it difficult. Is it could be that they've not had a chance to say goodbye to their loved one that they've lost, or perhaps even not in the way that they wanted to because of COVID. There's been a lot of changes to funerals, as I'm sure many of you are aware, in terms of the numbers of people that have been able to attend, the services that we've been able to offer, such as, even floral tributes, for a period they weren't allowed. Even things like not being able to bear the coffin for their loved one, again, due to the risk of spreading the disease. So things like that are all part of the grieving process, and often in many ways offer closure for a lot of people. And not being able to do that has had a serious impact on how people are grieving. And thankfully those people have reached out and contacted us for support. And it can be an incredibly lonely time, as it is when you're grieving for a loved one. But especially during the pandemic, you know, not being able to be with family or friends during lockdown has made it more incredibly difficult. And thinking again of those people that perhaps don't have access to technology, or you know, or even have, you know, their support network might have been groups that they attended, support groups, and no longer having that facility available due to services being closed and shut down over the past 18 months. They've been even more lonely during this period. And things like not being able to visit their loved one in chapel of rest. For a lot of people, that's also incredibly important as part of the grieving process. But of course, that's for a period of time that wasn't allowed. And, you know, there's lots of changes and things like that that are outside of people's control. And it's understandable that people might feel angry or distressed or overwhelmed, and that's all been exacerbated by COVID. Yeah, so next slide, please, Angela. And there's also, of course, other losses that are associated with not just bereavement, but in terms of that's been impacted through COVID as well. In terms of the home, there's been changes at home. Perhaps some people, you know, if they're in the process of moving home, that process has been incredibly difficult for them. Their health as well. Obviously our own health, and concerned about the health of loved ones and those around us, especially people that are clinically vulnerable. Pets, you know, divorce, people losing employment, which I think over the past year is particularly prevalent. A lot of people being on furlough, people losing their jobs due to redundancy, lots of factors. These are all losses really that can not only complicate grief, but also complicate sort of how we feel during the pandemic. Next slide, please. So at Bereavement Care, we are a very small team. At the moment, there are 4 of us, and this is kind of the area that we cover. So in normal times, pre-COVID, we used to be out and about a lot on the road. You kind of have to cut the edges off the map there. It's almost, we cover parts of each of these counties. The easiest way to think about it, if you're, or you know somebody who may benefit from our services, is wherever there's a Southern Co-op funeral care branch, we operate in that area. And the reason being is we are independent, but we're lucky that we receive our funding from Southern Co-op funeral care, so that we can provide the services that we offer. But yes, so we do cover a huge area. And sometimes even we go beyond that because we support within Southern Co-op as well in the retail industry. Yeah, next slide, please. So bereavement care, we're kind of split into 2 halves. We offer free educational sessions for professionals, volunteers, anyone who's working with vulnerable people or people suffering from bereavement. And we cover, I've got a few details on a later slide to show you when I get there, but some of the different workshops that we offer. And previously we would visit care homes, for example, or hospitals, and we would deliver in-house these education sessions. But obviously due to COVID, we weren't able to. So we had to very much adapt not only the presentations themselves and what we talk about, but also how we deliver them. So we deliver them online at the moment using Microsoft Teams. And we're hoping to be able to do them face-to-face, but we're not sure as of when that will be possible just yet. But we will obviously keep everyone informed about that, but we do look forward to that day. And similar we offer counselling and support services as well. So we do one-to-one counselling, which again used to be face-to-face, but we've had to change that, and it's primarily on the telephone at the moment, although we do offer it on Microsoft Teams as well. And again, I think someone mentioned earlier that it's incredibly difficult to offer counselling at this time, you know, without doing it face-to-face, because like you said, you know, non-verbal communication is incredibly important. It's part of that process. But, you know, I mean, we wanted to continue to be there to support people, even if we're just somebody to listen to them. So, you know, I think using Microsoft Teams for those that do have access to that can be really beneficial, because you can see more of their body language and facial expressions and things. But that's certainly a challenge that we're still working hard to overcome, and looking forward to getting back to face. And in terms of other support services as well, we offer, in fact, I believe I've got a slide about that, so I'll come to that in a moment. But yeah, so different education sessions and talks that we offer. Could you bring up the first one for me, please, Angela? So this study, it used to be called our study day. I don't know if any of you have heard of it before or attended, but we've renamed it. It's now called What Happens When a Person Dies, and it's all about caring for the deceased and the bereaved. And the aim of the session is to dispel a lot of myths and concerns that people have around what happens when a person dies. So we cover everything from the first call right through to the funeral, and then aftercare, which we provide at bereavement care. And again, pre-COVID, we would take people on a tour around one of our funeral homes to show them, this is what's involved. It's about being open and honest and transparent with people, and also to a crematorium so they can see or learn about the process, what happens there. We have an understanding loss and bereavement workshop where we talk about what bereavement is, factors that can impact bereavement, and other losses that are involved as well. So a bit of what I mentioned earlier, but we go into much more depth. Anticipatory grief. So for example, what it is, how it differs from bereavement after a death, and so on, and lots of the challenges and some, even benefits of anticipatory grief as well. Anxiety and loss as well. We have a workshop about how that links with bereavement. We have a multicultural perspectives at end of life. So that's kind of looking at different funeral and religious rituals and customs that surround death within, some of the biggest religions or faith systems within the world. We have a building resilience workshop, that kind of stemmed out of COVID, really. We felt the need to be able to offer that to people to help support them during that difficult time. We have a session that looks at mental health well-being in relation to grief and bereavement. And mindfulness, again, that was something that kind of goes hand in hand with the building resilience workshop. We developed that as a way to try and support people, kind of like a self-help guide, really, to give people some tips and strategies on how to manage during this difficult time. And post-traumatic stress disorder as well. We talk about that, what it is, what it involves. Again, because I think it's something, there are a lot of myths around what PTSD is. So we kind of wanted to share that knowledge that we have. So yeah, in terms of our support services, we offer wellbeing groups, which unfortunately have been on hold over the past 18 months. We have stayed in contact with those people that previously attended the groups via phone, but we are looking and we are hoping to start that up again fairly soon. We've kind of got a provisional date in mind with GVA to start a group in Gosport towards the end of July. It just all depends on what the government say, whether we're able to do that. But fingers crossed we'll be able to do that, and obviously put appropriate safety measures in place. And friendship groups for those clients who perhaps feel that they're a little bit further along in their grief journey from the wellbeing groups and are ready to sort of start going back out into the world more, which I think will be particularly important following COVID. So hopefully that's a service that we'll be able to continue or perhaps expand. I've mentioned about the one-to-one supports, and I briefly touched on colleague support as well. We're there to support the people we work with. So yeah, you can't see me on the camera, but there I am. And these are my lovely colleagues, Janet, Ange and Leslie. Again, some of us are qualified counsellors, others we're in training at the moment, but we offer befriending services as well. But yeah, this is us. And through COVID, we took the opportunity to develop our website, because we were previously called the Bereavement Centre, which you may have heard of if you haven't heard of bereavement care. But we used the opportunity to create a new website, a Facebook page, which, you know, the details are there. I don't know if you can read that on the screen, but it'd be lovely if you could follow us. We do post sort of updates on there and share different stories and such things. But yeah, new website, which is absolutely lovely.
Thank you very much. I'm going to stop you there because we're just moving on with time. We're running out.
Yeah, no, it's fine.
But Terry, there's a couple of quick questions. So I'm just going to feedback. Ted, who previously worked with Cruise, he's asked, have you seen or are you seeing increases in any particular areas, i.e. bereaved by suicide, or have you noticed anything in that area?
We have, sadly, yeah, that we have had more people that have been affected or bereaved by suicide, certainly. I think a large part of it is the isolation side, and people having that lack of closure from not being able to say goodbye at funerals the way they would have liked, or even to being able to be with their loved ones when they passed in hospital or home, wherever it may have been. A lot of people are finding that incredibly difficult. But yes, sadly, there has been an increase in suicides, which we are.
Yeah, I think there's no. I assume that was to be expected at this particular time. There's a comment in there from Roz, but I'm going to move on. So if I could ask, if anyone wants to ask Terry any questions or make any other comments, Terry's going to keep an eye on chat. So if I can hand over chat to you, Terry, and we'll just move on for the last couple of minutes. Just to highlight, Jackie mentioned it briefly at the beginning. You should be aware, because hopefully Lynn has circulated to all members, unless anyone's new, and they can contact Lynn Dudman if you haven't seen the poster. Your health and welfare, just to highlight, I believe Lynn said that there was a cabinet member announcing today that we are on track for the 19th of July reopening and sort of restrictions going. So we're keeping our fingers crossed. The day after that, 20th of July, is the Health and Wellbeing Fair, the first health forum organised Health and Wellbeing Fair covering Fareham and Gosport. Jackie mentioned there'll be taster sessions, walking for health. There will also be an opportunity for any Health Forum members to deliver short, probably up to about 15-minute presentations. I've already had a couple of requests. If you haven't got a table, and lots of organisations have got tables there's about 16 or 17 from the Poppy Factory, Connect to Support, obviously Community First and Gosport Voluntary Action, the Macular Society, Harbour Cancer Support, Age Concern Gosport, Parkinson's, Southern Health, Friends and Partners Through Pain, Citizens Advice Gosport and Citizens Advice Fareham, Open Sight, Stop Domestic Abuse, Age Concern Hampshire, and Motivate to Date. There are still few tables left, so if you wanted to book a table and you haven't, you can contact Lynn. She's circulated the form already. But equally, if you wanted to book a little slot, 15 minutes, you're very welcome to do so. It's open to all Health Forum members. So do support it. And if you've got Facebook, if you've got social media or a website, please promote it. We've sent the poster out, but if you need another copy, Lynn can circulate it. So it's our event, and part of that event will be an opportunity for yourselves to engage with other organisations that you haven't seen for a year or so. So please do come along if you can, and encourage your members to do so. So we're approaching 2 o'clock. I need to say a big thank you to our presenters, to all who've supported background today, as well as the front presenters. I particularly want to thank Lynn Dudman, because without Lynn's support, none of us would be here today. Also to say thank you to everybody who's given up their time to attend. It's really much appreciated. The date of the next Fareham and Gosport Voluntary Sector Health Forum meeting is face-to-face. It's going to be the 12th of October. Full details of the address, etc., will be circulated, but it's going to be in Fareham Community Church, which is sort of West Street, and it's 12:30. Just bring your own sandwich or a piece of fruit, whatever you want to eat. 12:30 starts normally with a bit of networking. And then it will continue on until 2:30 p.m. So it's really going to be brilliant to welcome everybody face to face. And then in 2022, what we're thinking of doing is alternating, because what I'm very aware of is, although it is in some ways limiting having online meetings, it does also mean that more people can attend, because quite often people have got an hour meeting before and they've got an hour meeting afterwards, but they can fit in an online meeting. So I think what we're thinking of doing is one face-to-face, one online meeting. So it will be a mix in 2022. If there's any feedback that you've got for Lynn or any other ideas of themes that you'd like covered, please jot your ideas and your comments into chat now, or drop my colleague Lynn Dudman an email. You would have all received emails from Lynn if you're a member, but if you're not a member, that's her email address there. If you aren't a member, you won't get the updates, so please do drop her a line and ask to join if you'd like to. So I just want to say, I'm really hoping that everybody has a very happy and healthy summer, and I look forward to seeing you in the autumn. Some of you will meet me in other meetings, no doubt, between now and then, but thank you very much for attending, and you're now free to go. Thank you very much.